Hi, my name is Sharice Mashishka. I'm going to be your student nurse practitioner today, and I'm going to be performing your head exam. So, are you able to tell me your name, please?
Rick Mashishka,
And your date of birth?
8/15/81.
All right. I'm going to close the door. I'm going to pull the curtain. I'm going to provide some privacy for you. I am going to use a little bit of hand sanitizer on my hand because I will have to touch your face if that is okay.
Sure.
So right now I'm just expecting your face. I'm looking for symmetry. I am looking for overall if there's any abnormal muscle twitching, anything kind of spastic movements, which I do not see. So now I am just going to palpate your head, and I'm just feeling for any lumps, any bumps, any indentations, which I do not see or feel. I am going to palpate your temporal pulses, which are about a 2 plus. Very good. And while I'm here, I am going to palpate your frontal sinuses. Is there any pain or pressure?
Nope.
And your maxillary sinuses, any pain or pressure?
Nope.
No? All right, good. So now I'm going to move on to your eyes. I'm looking at both your eyes. I am looking for symmetry once again. I am looking for any drainage, any redness, and they look good. I'm checking out your sclera, which looks to be white in color, which is a good color. And then I'm just going to pull down on your lower eyelids, if you can open your eyes, and I'm checking your conjunctiva, which should be a nice pink, which yours are. So now I'm going to take my pen light, sir, and I'm just going to ask you to look straight at my nose, and I'm going to look at your pupils. Good. There. And your pupils are about a 4. So now I'm going to take my pen light and I'm going to shine it into your eye. I'm going to come in laterally and I'm looking to see if your pupils are nice, round, and reactive to light. And they go down to about a 2. I'm making you tear up there.
No, I'm just sensitive to light.
Sensitive to light, okay. One more time, I know you're sensitive to light, but I'm going to come in and look at your left eye, and I'm checking the right eye to see if that pupil constricts, which it does. And then I'm going to come into this eye, and I'm checking to see if your left pupil constricts, which is us. That is checking direct and consensual. So now I want to check your eye muscle movement. So I'm going to ask you to follow my finger, if you can. And you're going to...
Hold on.
That's okay. All right, just follow my finger. We're going to go up without moving your head. Good. We're going to come back midline. And we're going to check the other side. Good. And we're going to come back midline. All right. Now just look at my finger and you're going to follow it in as it comes to your nose. And your pupil should, that is a normal response. Your pupil, it's called convergence, and your pupils kind of look like they're going to go cross-eyed. Your eyes look like they're going to go cross-eyed. So now I'm going to come close to you and you're going to face me and I'm going to come from behind you and you're going to let me know when you see my fingers, okay? So let me know when you see my fingers.
No.
Now?
No.
Now?
No.
Now. Good. Good. So now I'm going to bring out my ophthalmoscope. And once again, I know your eyes are sensitive to light, but I'm going to turn my light on. And I'm going to have you look this way and look towards let me turn my dial to 0. And then have you look towards the light. And then I am going to help you over your eye. And with my right eye, I'm going to come in and check your right eye. And this is looking at the blood vessels, the nerves, making sure everything looks good. All right. And then I'm going to do the same with the left. I'm going to check my left eye to your left eye. And I'm going to come in. Good. And I'm checking. All right. And that looks good. All right, so your eyes look good. So now I'm going to move on to your nose. I'm looking at your nose. I'm making sure it's aligned and that it's not deviated. I'm going to switch my pieces here. I'm also checking for any nasal discharge, and I am going to use my finger and I'm looking your nose. And this is just checking to see if there's any swelling, any redness, sorry. Okay. And that looks good. All right. So
You're making me nervous.
All right, we're almost done. So I'm checking your ears out now. I'm looking, seeing they're symmetrical. I'm checking the outside, making sure there's no redness, no drainage. I'm pulling here. Is there any pain?
Nope.
No pain. Okay. And also with my scope, I am going to take your ear. I'm going to pull your earlobe up and back. And I'm looking. Looks so nice. Looking at that membranes. Good. Now check your other side. And looks good. Okay. Now, if you don't mind, I'm going to switch these out and then I'm going to check your mouth. Once again, with my lights, you can open your eyes or open your mouth. Okay, and I'm looking, stick out your tongue. Say ah. I'm checking your tonsils, your uvula. Stop saying ah. I'm checking out your hard palate. I'm looking at the overall condition of your teeth. Checking your gums. Just lift your tongue up for me. Good. All right, that's good. And as we finish up here, I'm looking at your neck. I'm making sure your trachea is nice and midline, that there's no deviations. And now I'm going to palpate for your lymph nodes. So I'm using the pad of my 3 fingers, and I'm just going to go in a nice circular motion. I'm going to palpate in front of your ear. I'm going to palpate behind your ear. I'm going to come down, check those tonsils. I'm checking for any bumps, any enlarged lymph nodes, mandibular. All right, and then I'm going to check your clavicles. And then can you turn your head this way? And I'm going to check right in between that sternocleidomastoid, deep clavicular. And then can you turn to the right? I'm going to check posterior clavicle, inferior clavicle, and then occipital. And then real quick, I'm going to go behind you. And I'm going to check for your thyroid. Thank you. All right. And can you swallow for me? Good. One more time. Good. All right. And overall, how's your skin? Skin okay? Any rashes, bruises, lesions that you're concerned about?
Nope.
And then I'd just like to inspect your nails, checking for the length, make sure there's no clubbing, and your capillary refill. Okay, and that concludes my exam today. Do you have any questions?
Nope.
All right, thank you for coming in.